Welcome to Adapt English. Today we're going to talk about things they will ask you when they come to burn. We have 10 questions, select or apply to include all the concept you have to know for the NCLEX nursing school. Are you ready? 10 questions, challenge yourself. NCLEX practice question on burn. Take a pen or paper, answer the questions on your own, and keep track of your score. Let's get to it. 10 questions on burn. First question is all concept. What is they going to ask you? They're going to ask you this particular question. There's no burn question that you will see that this question will not show up. And this is monitoring laboratory results for a client with what? Severe burn, which finding unexpected early after burn injury. Select or apply. Like I said, SATA question, 10 SATA question we're going to deal with. What should you expect when somebody burned themselves? Immediately, what are the lab work you're supposed to see? Decreased hematocrit, hypokalemia, hyponatremia, elevated hemoglobin, and metabolic alkalosis. Based on the things you know about burn, use it to answer the question. Stop the video, pick your answer, and I will give you the answer, how to approach it. You pick your answers. The first thing you're supposed to know is what? Like I said, pause the video before you listen to my explanation. But the first thing you're supposed to know is divide burn into 3 stages. All the questions we're going to see, we're going to do that. The first thing is what? Emergent. This is the resuscitative state. This is the early state. What do we care about? ABC, airway, breathing, circulation. That's all we care at this particular point. Then we go to acute phase. Acute phase is the wound healing, where we have to take care of the wound, take care of the graft. We already skin grafting. This time we already done what? Resuscitation already at the emergent phase. So we don't need to resuscitate anymore. Just caring for the wound, caring for infection, providing nutrition, everything for the patient. And the last stage is what? Rehabilitation. This is where we're bringing the individual back to their baseline, physical therapy, range of motion, and all those things. So these are the stages. And when they ask you a question, think about those stages. In this expected finding stage, which is what? Emergency stage, what is going to happen? When you burn yourself, the cells are going to die and they're going to release what? Potassium. Potassium is supposed to go up, not down. You get dehydrated. Your hematocrit go up. Hemoglobin goes up. You lose fluid, you become hyponatremia. Good. You lose fluid, your kidney shut down, you have metabolic acidosis, not alkalosis. Therefore, what are the right answer? You're going to have increased hematocrit, so this is wrong. Hyperkalemia, this is wrong. Hyponatremia, elevated hemoglobin, and metabolic acidosis. This is an expected finding, and that's lab work you should know when you see a question on burn immediately after burn. You should also know something about acute phase lab, so pay attention. But this is what you see in Emergent. Same question, but I change it, but it's the same thing. And then it's assessing a client who sustained terminal burn injury 2 hours, early burn, right? Which finding should the nurse expect during the emergent phase of burn? I put emergent. Now, this is another way they will ask you. It's the same thing as number 1. You don't have to memorize. The answers are different, but the same concept. I told you emergent phase is what? That's the beginning of the burn. It's not acute phase. Therefore, when you burn yourself, what is going to happen? I've given you the answer. Decrease urine output, hypotension, increase hematocrit, hyperkalemia, bradycardia. I set it so that you don't memorize the information, but they can ask you the same thing with different answers. You pick your answer, you stop your video, I know you pick your answer. Once again, kidney shut down, decrease urine output, expected. If you lose fluid, you have hypotension. You become dehydrated, hematocrit go up. The cell burst open, you have hyperkalemia. If you dehydrated, you have tachycardia, not bradycardia. But the same concept, answer the question in a different way. Select or apply. SATA question, English practice question. Match to them. Next question. And this is caring for a client with what? Major burn injury. Which intervention should the nurse implement during what? Emergent phase. The same thing. We talk about the concept, what you need to do for emergent. The easy way to answer question on burn is whenever they ask you, ask yourself, which stage are you? Emergent, acute, and rehabilitation. In emergent, what did I say? Resuscitation, resuscitation, resuscitation. Therefore, pick an answer choice that deal with what? Resuscitation. Initiate large bore IV resuscitation. Administer IV opioid for pain. Well, we got to give you pain medication, whether you like it or not. Apply ice to burn area. No, they're going to get cold. Monitor urine output hourly because we want to make sure they are not in shock. Nutrition, what are you going to do? Right now, we don't care about nutrition right now. We'll give you nutrition at what? Acute phase. At this stage, resuscitation, resuscitation. That's what is important. And this is monitoring a client with circumferential full thickness burn to the head, which finding indicate vascular compromise. That's the key word. Vascular compromise. You have to rewrite the question and ask yourself, is a selected apply? I don't have to pick everything. There's a vascular compromise. That means blood flow to that area is decreased. Therefore, which area of these questions, which answer choice indicate vascular compromise? Decreased capillary refill, distal pulses absent, severe pain in extremities, cold skin distal to the burn, bounding peripheral pulse. Which one indicate what? Decrease vascular compromise or vascular compromise. Capillary refill is decreased, bad. Absent distal pulses, bad. If you have severe pain, that means ischemia, like compartment syndrome, less blood flow, that's another sign. And if the extremities is cold, yes. But if your pulses is high, no, it's not. But these are little things you can apply to answer questions. Which findings should the nurse instruct the client to report about what a nurse is providing teaching after a full thickness burn infection? What do you tell them to report? Increased wound drainage, sudden hyperglycemia, dark brown eschar, fever, and confusion. If you're teaching a patient who have full thickness burn, what instruction would you give them? Stop the video, pick your answer. Let me know what you think. You pick your answer? I can tell you, increased drainage, infection. Severe sudden hyperglycemia, sign of infection. Dark brown eschar, an expected finding for full thickness burn. Don't pick it. Fever, infection. Confusion, shock. These are all the things you tell the patient. If you have burn, full thickness, you should let me know. And this is assessing a client with inhalation injury from a house fire. Inhalation. The key word is inhalation. That means looking to the nose and figure out if this finding indicate airway injury. When they ask question, the answer choice is in the question. Spend some time, look at it. That's what I call a common sense approach for answering question. Look at the question before you look at the answer. There is something in the question that will give you away. Inhalation injury. IV answer choice. I'm looking if he has something to the airway, and does it indicate that something is burned? Sink nasal hair, hoarseness, carbonaceous sputum, wheezing, hypertension. You pick your answer. Why would you pick hypertension? It's nothing to do with your airway. If you wheezing, airway. Carbonaceous sputum, something is burned, you're coughing, dark things out. Hoarseness, obstruction, airway edema, sink nasal hair. All of this indicate airway compromise. Number 7, what is your score so far? I know you're going to get 7 out of 7. A nurse is caring for a client with 30% total body surface burn receiving IV fluid. Just 30% receiving IV fluid, which finding indicate adequate fluid resuscitation. When it comes to burn, learn how to and find out if the patient is doing okay, whether they fluid overloaded, whether they have dehydration, and whether they are in shock. This is why it fall under what? Physiological adaptation. This is a big area of physiological adaptation. So you got to see that. Which finding indicate adequate fluid resuscitation? How do I know I'm adequately resuscitated? I'm not in shock. Urine output 25 ml per hour. MAP is greater than 65. My lungs are clear. My heart rate is 80. My extremities is cold. Which one indicate I'm adequately resuscitated? If you have a bunch of fluid, what would you do? You pick an answer? I know you pick one. Therefore, urine output 25 ml, you are under resuscitated. You need more fluid. MAP 65, you're good. Your lung sound has nothing to do with your fluid status. Don't pick it. Heart rate of 80, you are not tachycardic. Good. When your extremities are cold, you are in shock. Therefore, that's a wrong answer. Number 8. Which nursing intervention are appropriate? Select and apply. A nurse is caring for a client during what? Acute phase. This is what I was telling you. Always pay attention to the phase that they're talking about. Acute phase. What is the acute phase? These are the things you finish the resuscitation. Now you care about the patient, their nutrition, their wound, and everything. Therefore, perform daily wound care, give them high protein, maintain sepsis so that we don't have to cause infection. Range of motion, exercise, and skin grafting. These are all expected findings. These are all the things you do. These are all the things you initiate in acute phase. Know them. And as is teaching a client about prevention of what? Contractures. Which action should the nurse include? How do you prevent burn contraction? This is why we move burn patient joints so that they don't get stiff. That's what it means. Splint the affected joint, perform frequent range of motion, maintain functional positioning, avoid movement of the burn joint, and use physical therapy. I've given the answer away, right? Burn joint need to be moved, otherwise you form contraction. Therefore, splint it is good. Perform range of motion, maintain functional positioning, and use physical therapy. You should not avoid moving them. And the last one, when caring for a client with chemical burn to the skin, which intervention should the nurse implement first? If there's a burn to the skin, what do? You take them to go to the emergency room, remove contaminated clothing, irrigate the area with copious water, apply topical and antibiotic immediately, brush off all the chemical before irrigation, assess the airway. What do you want to do? Select and apply. Remove contaminated product is better. Irrigate the area with copious water is good. Well, antibiotic is irrelevant. Brush off the chemicals before irrigating and assess the individual airway. 10 questions. NCLEX practice question. Burn, select and apply. SATA question to test your mind. What is your score? This is challenging, fast paced to let you master burn. You don't have to memorize. Use the concept. Think about shock. Think about what? All the 3 stages you need to know and what you do at this stage. That's all. Take care of yourself. And thank you for watching.